Today is World Diabetes Day, and the organization Doctors Without Borders has raised concerns over insulin pens. South Africa has run out of the pens for people with diabetes as the global pharmaceutical industry shifts production priorities to weight loss drugs that use a similar device for delivery. Today, MSF and other organizations picketed outside the offices of Novo Nordisk in Sandton, calling for a reduction of prices of insulin pens. For more on this, I'm joined by MSF's Leena Menghaney. Leena, a very good afternoon to you. Thanks very much for your time. Tell us why you're making the link between South Africa running out of pens and, of course, the pharmaceutical industry that has now shifted production priorities to weight loss drugs that use a similar device for delivery. Does similar mean the same? I'm just trying to understand how you make the link between the two.
How I make the link. So today is World Diabetes Day, and what we wanted to highlight with the Novo picketing, along with Treatment Action Campaign, people with HIV, people with diabetes, was that there has been a double standard in the kind of treatment we provide to people with diabetes who are insulin dependent. In high-income countries, we give them insulin pens, which are easier to take, are less stigmatizing. In middle-income countries, we offer syringes and vials, which are complicated to measure doses, are more stigmatizing because they are very difficult to maintain privacy. And South Africa is one of those countries that has switched to insulin pens, recognizing that people with diabetes need the same standard of care. It is in the middle of their tendering that the human insulin pens were not supplied by Novo. So this is a very crucial area of work that we are doing. The pens are, of course, used across different medicines. And, of course, the drug Wegovy, which is used for weight loss, is also dispensed through a pen. So companies are shifting their attention to high-income countries for very lucrative markets and not supplying middle-income countries like South Africa, who've done a massive shift to improving diabetes care. And that's why we are picketing Novo today.
Okay. Let's talk about, diabetes. Today being, of course, World Diabetes Day. It's still killing many people. It's still endangering the lives of many people in this country, and the numbers are quite high.
Yes, and I think this is what I'm from India, and this is what we share with South Africa. Both South Africa and India have rising numbers of people with diabetes. And what we are asking our governments is to, along with the World Health Organization, to have improved guidelines and improved care and treatment with better drugs for type 2 diabetes and also better ways of delivering insulin. So yes, we are sitting on a public health challenge, an epidemic of diabetes, and we need every tool in the toolbox to improve the lives of people with diabetes.
We hear a lot about lifestyle and how actually the risk can be reduced just by a change in one's lifestyle.
That's a very interesting question. And I think I would like to circle back to some of the things that we need to do for diabetes. While we are working on access to treatment, we also need to look at what food and how the food industry is offering, extremely packaged, extremely problematic food that's become part of our everyday lives. So it's just not enough to say that, it's about lifestyle change and put it on the individual. Governments will have to come up with regulations on how much salt, how much sugar, what is sold near our schools, what is offered in our school meals. To all of these aspects will then have to be dealt with. So it's not just about lifestyle, it's also about regulation, both in the context of high drug prices, but also in the context of the food industry.
But how vigilant are we in South Africa with regard to that very same argument that you are making? And I'm here thinking of a situation we're currently dealing with regard to pesticides and versus the agricultural industry and what people get sold, and other people complaining about how government is not doing nearly enough to actually make sure that there are regulations in place, or there are standards to be met, or even there are certain pesticides, in the case of pesticides, that are actually we should make sure don't even enter the country and don't make it into our fields and gardens.
So I just wanted to highlight that diabetes is not just reaching epidemic proportions. It's killing a large number of South African women as well. It's one of the biggest killers of South African women. And one of the challenges that we have in countries like India and South Africa, as you pointed out, is regulation. And like we did with, baby food, at the time when, breastfeeding was being undermined by the food industry, we will just now have to gear up to looking at the challenge that this generation is facing, both in terms of, not just access to medicines, but also, the food industry. So we are just starting to make those links, and we just need to start looking at those regulations. I am not an expert on those, but I can tell you this, that when it came to breastfeeding, activists across different countries worked with governments to tighten the regulations to prevent the undermining of breastfeeding. So if it can be done for breastfeeding, it can be done for other areas of the food industry. So I just wanted to sort of highlight a positive aspect of regulation that has happened in our countries.
Well, speaking of positive things, are there behaviors or practices that people have adopted which are beginning or have already made a difference in the fight against diabetes?
I work with in public health, and I just wanted to move away from that argument that it's about people's behavior. I think we are at a point where we need to look at what's driving the diabetes epidemic. And what's driving the diabetes epidemic is a range of factors. And all of that has to be incorporated into our NCD program. Just as we did prevention for HIV, we will have to look at a larger aspect of prevention for NCDs. So I would encourage us to work with the government on strengthening NCD programs so that they can offer not just treatments and diagnosis and screening, but also, prevention. And within that, I just wanted to say screening is a very important tool for early diagnosis of diabetes and getting into care. So I think there's a range of interventions that can be made by NCD programs. I can't speak for South Africa. I can tell you about India. We are just starting to have that discussion with the government in India about what to do about NCD. So this is the correct timing for all of us. The Guardian today pointed out 800 million people are affected by diabetes. It's reaching epidemic proportions. This is a time to sit down with NCD programs to hammer out the details of what we need to do for prevention, what we need to do for screening, what we need for treatment counseling, what we need to do for treatment and IEC.
Well, I was asking that question, of course, because, often people are advised to exercise, to eat properly, those kinds of things, which too, I would imagine, have a role to play.
Absolutely, they do. But we also have to recognize that, food costs money. And often the more improved diet you have and the more diversity you have in your diet, the more money it costs. And I think this is where I would say that we need to be very conscious that poor and marginalized communities have these challenges that they face towards what perhaps that is impacting whether they can actually change their behavior or not. And I think we've seen that in India as well. The more diversity and the better quality of food that you have, better quality of protein, or whether it is more fruits and vegetables, they all cost more money. And I think we need to look into that as a factor and not only at behavior change. Yeah.
Indeed. Poverty, affordability, coming into the picture there as well.
Yes.
Leena Menghaney, thank you very much for your time.